Basically, now starting the staging of the oral cancer T and M stage, which is very important. So let's start. Bismillahirrahmanirrahim. So basically, the primary tumor T denotes from. Acha. Always remember that TO is no evidence of primary tumor. Means there is no evidence of primary tumor. And one point I want to tell you: this staging you do when you either suspect that might there be a cancer. It is for the cancerous patient, not it is not for the non-cancerous patient. Okay, so you do staging and grading when you get to know. So if you have T so no evidence of carcinoma of no primary tumor, and TIS is carcinoma in situ. T1 is equal to or less than 2 centimeter, T2 is more than 2 centimeter but less than 4 centimeter, and T3 is actually more than 4 centimeter. T4, either the cancer will either invade the structures such as cartilage, bone, muscles of the tongue, skin, and soft tissues of the neck. T4 is either moderately advanced local disease. It is actually advanced but moderate. T4B, very advanced local disease, very advanced skull base, pterygoid plate. You will involve internal carotid artery and investigator space. Okay, regional lymph nodes, if it is TX, so no nodes cannot be assessed. TX, sorry, NX, T T N, not you say T NO, sorry, NO is basically no lymph nodes metastase. Means the lymph nodes are not metastasized. And one is that there are single positive, means lymph nodes are present apsilateral, means on one side, but less than or equal to 2 centimeter in greatest dimension. N2 N2A is a single positive apsilateral lymph node more than 3 but less than or equal to 6. It is either less or equal to 6. N2B is multiple apsilateral nodes but less than 6 centimeter, N2C is bilateral contralateral lymph nodes but less than 6 centimeter. N3 is lymph node but more than 6. Distant metastasis for MO is no distant metastasis, and M1 is distant metastasis present. Now staging or grouping, you say it is very important. It can come in your auspice also. So number 1 is stage 1. You have T1. T1 means that the tumor size is less than or equal to 2 centimeter. NO. NO is basically no lymph nodes are metastasized. Okay. And MO is no evidence of no distant metastasis. T2 is for more than 2 centimeter but less than 4. And again, there were no lymph nodes metastasized, and MO is like no distant metastasis. T3 is actually means that you have more than 4 centimeter, and again lymph nodes are not metastasized. Okay, no distant metastasis. And T1 and to T3 it comes, and then it has N1 means your tumor, your lymph nodes are now involved. Single positive apsilateral lymph nodes are they are actually equal to or less than 3 centimeter and no distant metastasis. T4 is actually you have T4. So they have not mentioned this. So you can say they either it will invade the cartilage, cortical bone, muscles of the tongue, or basically soft tissues of the neck, or either it can reach to the skull base, pterygoid palate, internal carotid artery, or masticated space also. And NO is basically no lymph nodes are metastasized and no distant metastasis. Then you have T1, T can be anything. Then N2 to N3 can come here. Basically no metastasis. And then the last stage, they okay. So remember there is T0, TO means there is no evidence of primary tumor, no lymph nodes are metastasized, but there is M1. So in this it is metastasis. In metastasis, always remember you will give the chemotherapy. Okay, you will give the chemotherapy because it is metastasized. Okay, so basically